been meeting with clients and had a number of people I saw over the course of the time where I think I was infected and didn't know it. Well, it was, I guess, not this past Saturday, the Saturday before, that night. And I only, in retrospect would say as symptoms, I had a headache. And I said, I have a headache. And so I took a couple of Advil. And then the next day when I got up, I wasn't doing so great. So I stayed in bed. And then I've pretty much been in bed ever since. So it's been, I'll call it minor symptoms. It's mainly been a consistent fever. Very rarely has the fever been gone. But we definitely started to think it could be coronavirus when we looked at the 3 hours I had spent at Newark Airport and then 3 days at a conference where people had flown in from all around the country. It just seemed like it'd be possible that I could have contracted it. So we did the Baylor Scott White online questionnaire and put in there that at that point I was on my 5th or 6th day of having a fever, and that it had been pretty consistently above 100 degrees for that whole time, and that I had been at this conference, and that I had also spent 3 hours in Newark Airport at that critical time. So the timeline just seemed to work. So we were happy when they said that I should go get tested, trying to limit any exposure that my family has to me. And so far they don't show any signs of having coronavirus. So we're hopeful that neither of them will get it. Yeah, wife and I have a 19-year-old son. There's so much information out there that you can't get tested, and I guess I didn't have that experience, and I wasn't in one of those at-risk groups, and I wasn't seriously ill, but the circumstances of what I was going through, I guess, were substantial enough that they decided that I should have the test. There's diarrhea that was probably shortly after the headache. That was the first symptom that showed itself. Again, at that point, I had no idea that was even a symptom of coronavirus. And then I think the one thing that made me think that it could possibly be coronavirus was that I had this pressure in my chest. So I would just feel this pressure kind of my breastplate, and not, almost like a mild heart attack type of pressure, I guess. And I thought, well, that seems like that could be a symptom. So those have been the primary symptoms. I cough occasionally. The cough hasn't been too bad or too consistent. They tell you to treat the symptoms, so I take cough medicine and I take Tylenol for the fever, and I've taken NyQuil, which kind of handles all those things at bedtime, and just manage the symptoms. I wasn't terrified. I'm not. I'm certainly concerned. I'm trying to pay a lot of attention to to my breathing, whether I'm having any breathing issues or shortness of breath. That to me is really what I'm trying to pay attention for. If I have any of that, then I'll want to go get helped. But other than that, I'm just going to try to rest and wait it out and just improve it. I looked it up. It says it takes about 2 weeks to get through it, if it's a mild case. And so I figure I have another 4 or 5 days. Lots of TV watching. I've tried to do some work. So we set up a little makeshift office in my bedroom, and I've tried to do some work. But once I found out that I have it, I pretty much have stopped that. So once they called me, we figured I had it. They didn't even need to say I had it at that point. We knew that's why they would call. If they were testing thousands of people, they weren't going to call all the people that were negative. They said it was presumptively positive, and it now goes to the state health department to get tested again just to verify. And then after that's completed, I'll get called by the Texas Health Department. And then they instructed me to stay away from everybody until I'm symptom-free for 3 full days. My wife and son also now needed to stay in the house, and they weren't allowed to go out either for the next 14 days to make sure that they didn't have it, and they need to stay completely away from me during that time. So I'm pretty much secluded to my part of the house. I've been brought a box of food. I have a cooler. They leave food outside the door for me at times, and I just stay alone back here and mainly watch TV.